Welcome to the Triage Method podcast Q&A edition. These are going to be some new episodes that we can get some information out to you guys in a quick, convenient fashion without having you go to our site and read some of the Q&A articles that are over there already. So these shouldn't take very long. If you're on your commute, you're on your break, this is the perfect time to listen to one of these episodes. So these will be coming out every Thursday. And yeah, that's that. We won't waste any more of your time, and we will just get pretty much straight into the question. So the question we were going to discuss this week was, should your knees, or can your knees, or is it dangerous for your knees to pass beyond your toes during a squat? This question generally comes from a place of concerns about injury or pain. Like, that's typically the concern that people have. And I recall when I first got into fitness and training, this being one of the most common cues that I was given and that I was taught and that I would read about. Okay, so and that hasn't really changed very much. Like, just last year, I heard, a physiotherapist give the same cue, like, oh, keep your knees back, don't let them go over your toes. It's bad for your knees. So there is that kind of belief that is out there among lots of personal trainers, among lots of everyday people in the gym, and among actual healthcare professionals like physiotherapists, doctors, etc. So that's why this is an important conversation to have. Is this something you've heard of in the past, Paddy? Is this something you've come across in your time training people?
Yeah, like this is actually one of the most common, like you said. Like, people are kind of afraid to see their knees go past their toes, and you'll see people coach it or cue it in the gym where they're like, oh yeah, your knees to your toes, like they're just over your toes. That's perfectly fine when you're squatting down, but as soon as those knees start going forward, that's a no-no, right? And you can see again like how over time this has developed, how this has come about, because you look at it, you see a lot of people put their knees over their toes, and automatically their heels start shifting up. They don't have the ankle range of motion, we'll say, to actually support that, so they start going up on their toes. So maybe it develops and you kind of get people going, oh, just keep your heels down, so don't let the knees go too far forward. That's one way that you see people kind of cueing that, and you go, okay, I can start getting some rationale for that. But then you also see it from the, we'll say, medical side, where people make up, I'm not saying make up, but they come up with all these thoughts and ideas about like shear at the knee, and the different forces within the knee, and how that's dangerous for the knee structure itself. So you've got this very intuitive cueing where you're like, okay, I'm seeing something happen here, and your knees go over your toes, your heels come up. Let's stop doing that. Let's not let those knees go over your toes. Let's keep the heels down. Now you're in a better, more stable squatting position. And then you also have stuff like the scientific or medical side, where it's like, oh, here's some support for that idea. And then you also have people who generally haven't squatted before, haven't got into that range of motion, or haven't done that in a long time. They don't have the strength in that position, and they squat down. They're like, oh, my knees actually hurt. So you as a personal trainer, especially if you're new, or you as even like a physical therapist or physiotherapist or anything like that, you're kind of like, if you're new, you're kind of like, I don't avoid the pain. Let's not get into this painful. Let's see if we can modify this completely so that we get out of that painful position. So it's very simplistic in terms of the advice that is given, and you can see how it would develop over time into a kind of mantra or like dogma, where it's like, just don't do that. Like, even if you have a client come to you and they have the fucking most perfect, Olympic standard style squat, and you're just like, you almost want to coach that out of them, and be like, oh, don't put your knees over your toes. It should be, just over the toe is perfectly fine, but anything past that, you're gone.
Yeah, and like you're alluding to, I think the important thing to recognize when it comes to these kind of myth-busting topics, you could call them, is that, like, they're generally filled with half truths. So it's not like the people that kind of came up with these ideas, or the people that propagate these ideas, are coming from a place of like total idiocy, like they don't understand anything. There's no basis for why you would hold this belief. Like, you can see, if you have a certain thought process, you could come to this conclusion. Like one example would be, for example, if you are a physiotherapist and you happen to work with a lot of people who have, let's say, anterior knee pain, some sort of knee pain, whether they might have osteoarthritis and they might have a patellar tendinopathy, whatever it is, okay? So you're working with that population, and then what you find is you begin to notice a pattern over time that when you cue people to sit back more and don't let their knees travel forward as much, they don't have as much pain. So what you're seeing is you're gathering these observations within this specific context at this particular point in time. And then what you do is you generalize it to the rest of the population, which is just like, that is pretty much anti-scientific. Like that's not how you would come up with any sort of scientific theory. It's pretty much the opposite. Like in that case, what you would be looking to do is, right, let's find the individual who when I cue them to do that, it makes no difference. And then I'm like, all right, now I've got to rethink my theory. Now I've got to think about like why that is the case. So in that case, what someone might do is they've went through a seemingly valid process of identifying all these individuals who are responding in a particular way to that intervention of not letting the knees go forward. And then they've generalized it. Okay. And that could just be a problem of someone's understanding of how you actually come up with a theory. And that's perfectly fine. Again, I'm not saying that if you have this belief that you are just dumb. Okay. So there are contexts in which using cues like this like in a lot of these conversations that people just fail to acknowledge is that like the distinction between humans and machines is that we adapt. Like that's so important, okay? Because the way that we talk about forces often in the body, and the way that we talk about biomechanics and risk of injury, etc., we talk about it with the assumption that we just wear and tear and break down. Okay, so that's our starting assumption, is that humans just wear and tear and break down as you expose them to these forces. And you can see how that plays out in the everyday language that people use when they talk about exercise. For example, like I'm studying medicine, and you would assume that this is the one place that like you wouldn't have these kind of misguided beliefs propagated, but people still say, oh, like I was taught 2 weeks ago that, oh, osteoarthritis is just the result of wear and tear. Not true. Like that's a total oversimplification, and it's fundamentally incorrect to some degree. So like you've got this.
Just to put that into context for people, like you think about it in terms of, say, resistance training. Like you put a wear on your body, and it doesn't tear; it gets stronger over time.
Mm-hmm.
Like the body is an adaptive organ, like you're saying. So like that's how people should be thinking of that whole thing. Even though like it is very simplistic, and it is something that really, like I used to think, I'd be like, oh yeah, like it's just wear and tear on your joints, or you're fucking, you do a lot of bench pressing, your elbow gets wear and tear, and that's whatever, you're stuck with that for life, kind of, but once you start understanding like the basics of, just even the joint structures themselves, but even just like ligaments, tendons, you start looking in a little bit deeper, and you're kind of like, these things seem to adapt to the load that is put through them, the forces that are at that joint or whatever. And yes, there's definitely the ability to over stress that structure, whatever it is, or not have enough recovery. Like you've essentially done too much and not have enough recovery to get past that. But that's, if we're talking over a longer term, which is this kind of stuff we're talking about here with the knees over your toes, in the longer term, whatever, view on this, it's like you actually have to think, like, why would putting your knees over your toes, which again, putting into a natural context, you have to put your knees over your toes if you walk up the stairs. Like you like, if you want to watch someone walk up the stairs without putting their knees over their toes, like, it's quite funny, they have to do like some very exaggerated, sweeping of the legs out type movement, so you always say that as well with physiotherapy, where they'll prescribe kind of like body weight exercises, but then they kind of move to like a resistance training program, and it's like, oh, wear and tear, we need to be aware of that, even though it's like once you're able to manage the load, being applied to that joint, it's like like, how is this thought process not fully succinct all the way, you know? And they're not kind of explaining why one is okay, but the other is not okay, assuming that, the adaptations are taking place.
Yeah. So like, and the place that this ties in with that discussion, with this discussion, is because like fundamentally what is happening when you put your knees over your toes, like most of the time, like the reason people are concerned about that is that because it's increasing quote unquote forces at the knee. We're not going to break down all those specific forces, but very simply what you can think of is that it's increasing the challenge that you're going to experience at the knee joint. But like you can adopt two perspectives on that. You can say that, right, humans are like cars, and increasing forces is going to lead to wear and tear and like breakdown over time. Or you can say, oh, this is actually positive because what we now do is we increase load at that knee, that person's going to get stronger, and then boom, they've got more resilience to future stressors that they're going to be exposed to inevitably. So like that's two different actually do have belief sometimes, but not other times. So an example of that would be the decline squat. The decline squat, where your heels are elevated and the goal is essentially to drive your knees over your toes, is often used as an intervention for patellar tendinopathy. So in that instance, what they're doing is they're taking a more positive, optimistic approach on how the human body responds to load, and they're providing the exposure so that they get the adaptation and then there's resilience to future stressors. So that is a far more useful framework to adopt when you're thinking about these sorts of things. So if we sort of
Just,
bring that
just,
back to
just
the,
on,
go
just
ahead.
on that
Yeah.
exact topic as well. Like I have Osgood-Schlatters disease, right? And I remember going to the physio when I was like, we'll say maybe 15, maybe 16, somewhere around that age, and them telling me that I shouldn't get into these deep knee bend positions like a squat or whatever, because that did used to cause me pain, right? But then one of the exercises they prescribed to me to help with it was that kind of decline, well, heel elevated squat. And I was like after the first like 2-3 weeks of doing that, I was like, how come that one's okay? Where it's like we're exaggerating this knee bend position, but you're telling me to avoid getting into these like deep knee flexion positions, and they just had no answer. So I just stopped going back to them anyway. But like that in my mind, I was like, how does this make sense? But yeah.
Yeah. So like that is essentially the perfect example. And like you see it at the shoulder, you see it at the elbow, you see it at all joints, where people have these rules of thumb that just aren't really rules of thumb. They're just kind of like, oh yeah, we're going to say this. It's almost like we protect ourselves, but then there's other instances. But anyway, so where this comes back to this question is that, right? So we've got the knees over the toes issue, primarily perceived to be an issue because it's increasing quote unquote forces at the knee. You can adopt one of two perspectives there, that is a positive thing or that is a negative thing. Most bodybuilders would typically view that as a positive thing. Like you'll see like anyone interested in hypertrophy going out of their way to try and get into that exaggerated position where the knee is forward and the knee is in deep flexion so that they can kind of pretty much maximize their training response. Like you see that all the time. If you watch any Olympic weightlifters, typically they've got like pretty damn large quads, pretty damn strong lower bodies, and they're essentially doing the same thing over and over again. But like that's not to say, again, like this is the other side of the conversation, that's not to say that that is benign either, because you could be the person who's an Olympic weightlifter and like if you know for bodybuilding, like they could train easily 3 times a day sometimes, especially at the high level. They're doing that pretty much every day. They could be maxing out in their squat or close to it or some variation every day. So like this is the key distinction, is that just because you adopt an optimistic perspective on what humans can do and on the potential for adaptation, it doesn't mean like, oh cool, I'm just going to go squat 3 times a day and it's going to be fine even with my knees over my toes. Like at that point you're talking about a loading issue rather than a specific positional issue. Like if it was the case that Olympic weightlifters decided to change their squat technique and never let their knees go over their toes and still train 3 times a day, is there going to be less issues presenting there? Probably not. It doesn't really matter at that point. So when you're talking about there being some sort of quote unquote breakdown or the presentation of injury or pain, you're typically going to be more concerned with the overall loading that someone's been exposed to, as opposed to a specific position. Generally, specific positions can be used as like symptom modifiers, and that's essentially what I want to bring this back to now, because I don't want people to think that there's no place for telling people to keep their knees back and not letting them drift forward, because there is a place for that. One example would be the person who does have some knee pain, for example. So they got some knee pain, let's say it's aggravated by deep knee flexion, especially on any sort of upright squat where the knees are traveling forward, but they want to continue training. Box squat variation, where they're sitting back a bit more, that actually allows them to continue training. And they're still training that knee, they're still training those quads, still training their hip extensors, etc. But the proportion of the load that's being distributed to that joint is a little bit lower, and hence it's not beyond that person's threshold at this point in time. So what you're doing is you're adopting the perspective that I can still load this person, but I've got to do it slightly below their threshold, and then aim to push that line up over time with the eventual goal of getting back to their baseline. So I guess if I was to summarize like all of that, essentially what we're saying is that the using knees over toes as a rule as being harmful is pretty much unfounded, as in it's not a useful rule. There may be some instances in which you might observe patterns where this seems to be true, but that's not how science works, so we can't use that as a theory. You can then adopt either a positive or a negative perspective on how the human body responds to forces. I would encourage you to adopt an optimistic one of movement optimism, where you're basically optimistic about the potential for us to develop adaptations and resilience in response to the stresses we're exposed to. That movement optimism term is coined by Greg Lehman, by the way. He puts out good stuff related to this. But yeah, so the knees over toes issue essentially comes back to your perspective on the human body's like adaptive processes, and I think it's better to be optimistic about that.
Yeah, like I always think of any of these questions, it basically comes back to exactly what you're saying, but to put it in a different way. It's basically like there's no bad movements, there's just unprepared bodies, and you can look at that and be like, okay, well, I'm unprepared, my body's unprepared for this, so I'm never going to do it. But it's like your body can adapt and become more prepared, and obviously there's genetic limits, biomechanic limits, like I'm not saying that, you as a 70-year-old start doing this, you're going to get the same capacity for a deep squat as you would have if you had started when you were fucking 6, like adaptations, while they do happen, they do take time as well, so you have to factor that in. But that's the way I look at all this stuff. It's like, okay, like, yes, we may need to modify an exercise or a movement or whatever for where you are right now, but once we keep the optimism of that movement capacity, like you're saying, in our mind, and be like, okay, so this may be something that we want to work on over time so that you can get a better knee flexion position. Like I've had people come to like our coaching or whatever that, maybe a few years ago they had some sort of knee surgery, ACL or whatever, and it's like since then they haven't done this kind of movement because they've just been too afraid, like they haven't got into a deeper squat position. And, for them, you might be like, okay, well, we're going to start off and we're just going to not do, knees over the toes. We're going to start there. We're going to start wherever you are comfortable. And we're going to slowly work on building up your resilience, building up your capacity. You might be starting on a really high box squat for them, where it's like, it's a 15-degree knee bend, and that for them, that's their capacity, and you just work on it from there, So if I was to come away from this thinking back to when I was younger, when I started training myself and when I started training others, if I could just go back and tell myself that, the human body has the capacity to adapt to a stimulus. So just because you don't have something correct right now, that doesn't mean that you're stuck like that for the rest of your life. You can adapt to the movement demands, and yes, it might take a year, 2 years, 3 years, 5 years to get to where you want to be, in terms of knee flexion in this case. But that is something that you can adapt to, and I think if you limit yourself and say like, oh, like the knees can never go over the toes in a squat, and just use that as dogma, you miss out on helping a lot of people with their overall goals. And also you may even potentially hinder people in their long-term progress, and especially in their long-term approach to all this health and fitness stuff, because you've essentially given them this kind of fearful thought process around a pretty basic movement.
Yep. I think that's pretty sound. I think that covers most of what we wanted to discuss. Anything else to add before we finish up?
No, that's it. But yeah, I think hopefully going forward, people enjoy these smaller kind of Q&A ones. Like there is in the description a link to where you can submit questions, because we have about 20 questions that users have submitted. Like obviously some of them, like we're not going to read out the exact question. It might be like a paragraph long, and we'll just essentially summarize it and ideally cover all of the things that were asked in the paragraph or whatever. Because like I hate that when people do that on their podcasts or their fucking things. Like they read out this paragraph long, and it's just kind of rambling all over the place. I'm like, I actually don't care exactly what they asked. I just want to get the gist of the question, and then I want to get the answer. So hopefully that's what we'll do. But you can ask your questions, because I think this is a good format where on the podcast, essentially what we'll start doing is covering more, we'll call it meta topics, where like it's a bigger overview of a specific thing. So that it might be questions, because I know there's a few we have planned that come from questions that people have asked, but it's like, oh, this is actually a bigger topic. It's going to be much longer than the quick like 15-30 minute video on a specific question that someone has asked. But this is your opportunity to ask questions. And like obviously you always have the opportunity to ask questions in our free Facebook group. So, obviously get in there. But if we think it's a really good topic, they're like, okay, this will actually really benefit a lot of people that listen to our show and, aren't in the Facebook group. A lot of people don't have Facebook these days. So
better off.
Yeah, well, I don't know.
Better off for our Facebook group.
Better off without Instagram, but Facebook's all right. Yeah, so that's ideally what we're trying to do with this. So again, if you do have questions, like get them submitted in. Like it really does help us tailor the content to what you actually want to get from this, rather than just kind of like us thinking up topics and going, maybe people will be interested in hearing that. Like this is where you get your questions answered. So like I don't care if it's oddly specific to your situation. You're like, like I honestly, it could be the most specific thing to your situation. But if you think that it's something that we can discuss on the podcast, we'll discuss it there. If you think it is far too oddly specific, then you can ask in the Facebook group, and we can help you out with more specific information then. Or of course you can always engage with either the group coaching we offer or the online coaching that we offer. But yeah, Gary, I have nothing else to say. Do you?
Nah, not really, other than the fact that it is in fact too easy.
Okay.